Oh, is it?
Hasn't started. All right. Hey, everyone.
Hi.
I'm Alina Klein. I'm a therapist at Harper Therapy, and
I'm Tony Gorn. I'm an intern with Harper Therapy.
Today we're going to talk to you all about addiction and its effects on family members. So I have some experience working in addictions at a substance abuse rehab locally, and Tony has worked at a jail. Do you want to talk a little bit about that?
Absolutely. I worked in child welfare for 10 years, which is very integrated with addiction. And then I have also worked at the Land O'Lakes jail trying to help people who struggle with addiction and setting them up with services when they're released. Because there's a big need there in Pasco County. So just working with them and getting them services, getting them some outpatient services, setting them up with sober living. It was a very interesting experience.
Right. So as Tony knows, as I've seen, for every person that is affected by the disease of addiction, there's like 5 more people who are affected by it just by nature of knowing and loving that person, right? So what we're here to talk about today is how does addiction affect family members and how can we help you to kind of navigate that process of someone's addiction and also maybe potential, hopefully, recovery. So, one thing that I think it's really important to recognize is that, and this is probably the hardest part of being a family member of someone who struggles with addiction, is that you cannot cure it, right?
Yes.
You can't fix it. And so family, like wives, husbands, parents of children who have this disease of addiction or alcoholism, they feel like they should be able to fix it. If I can just love this person enough or do this or do that for them, I should be able to fix it. And that just over and over again, time and time, we see that does not work.
Absolutely.
Right?
Yep. Yeah, giving them money or providing them, even just to always give them somewhere to go when they're getting out of jail or, if you're not setting up the right boundaries, you're not helping them.
Right. So that's a good, we talked a little bit about boundaries today earlier in our staff meeting, and boundaries are a tough thing to learn about and how to establish. It's like you want to do what's best for your loved one, but you also don't want to enable their disease. So one thing to keep in mind when setting boundaries is, if your family member, especially for someone struggling with addiction, if they can do something for themselves, let them do it. Right? Like, do not do something for someone that they can do for themselves, because that just perpetuates this feeling of this sense of lack of responsibility. And a lot of times what happens in addiction is people really struggle to take responsibility for their own lives and to start behaving and doing things differently.
Absolutely. And the other big thing with boundaries is making sure that you're setting boundaries for yourself and not necessarily for the addict. You don't want to tell the addict what to do because that's not helping. Right. But if you set up the boundary that in order for me to be healthy, you can live here, but you can't smoke marijuana in my house because that's not healthy for me. Right. But if you're putting it on them saying you can't be in my house because it's not healthy for you to smoke marijuana, that's not a healthy boundary for anyone.
Right. So all that to be said, boundaries are very complicated. They're actually very simple, but they bring up, when we set boundaries, it can bring up a lot of feelings, emotions, a lot of confusion. So that is why we're here. And as a practice at Harper Therapy, we don't necessarily focus primarily on addiction, but we do focus on relationships. And so if you have a loved one who is struggling with addiction or has gone to treatment, or you just need some help navigating through this process of someone who you love struggling with addiction, please feel free to call us. The number here is 813-434-3639. We would be happy to help you in any way we can, and we feel very, very passionately about helping families. So
we're here to help.
Yep.
Thanks, guys. Bye.